problems that the report, this African status report, have identified is that a full 50% of countries don't have the basic road safety strategy available in their countries to address road traffic injury prevention, although some countries are doing, and many countries have what they call lead agencies, but not necessarily the funds commensurate with the problem. And so, although they have an agency working in road safety, they don't really have the money to do much. We really need to take heed, because in the next couple of years, unless we take action, this is the prediction that WHO has, that road traffic crashes will jump to be the 5th leading cause of road traffic deaths around the world, accounting for some 1.9 million deaths annually, currently sitting at 1.3 million deaths. And this is one of the reasons why the UN has called for a decade of action for road safety, from the years 2011 until 2020. Our statisticians tell us that even if we just try to keep the level the same, or even just go down slightly, that we would be able to save 5 million lives, 50 million injuries, and $5 billion. The challenge is how to do this. And one of the things that WHO and colleagues, as Collins mentioned, the UN Road Safety Collaboration have done, is put together what we call a global plan of action. This is a plan that tries to guide countries on some of the basic principles around road safety. Now, we know there's no blueprint for road safety. We know that every single country is different. But we do know that there are some basic principles that can be followed. And so this plan offers those 5 what we call pillars that we need to address. I'm always struck when I come home by the incredibly fast speeds that are driven in this country. It scares me, quite frankly. I've become very European in my speed management, and really encourage countries to look at speed management, in particular in urban areas where speeds really shouldn't be more than 50 kilometers an hour, because it's not only for the people inside the car, it's for the people outside the car. And we have to remember that 50% of those people killed in Africa are vulnerable road users. Drinking and driving. Now, South Africa has a very good law for drinking and driving, and it's well enforced, but it could be better enforced. If you ask any Aussie if they've been stopped by a booze bus in the last year, 90% of them will say yes. That's where we have to get our enforcement levels up to. And South Africa needs to encourage some of the other countries around them to implement the good practice of a 0.05. It must be really difficult for the truck drivers to be driving down Africa and not know what the blood alcohol level is as they cross between one border and the next. And so trying to put in place good practices around drinking and driving will go a long way. The seatbelt, again, South Africa, very good seatbelt laws, patchy seatbelt wearing rates, but we know that the seatbelt has saved more lives than any other road safety intervention, and we really have to get levels up there, around 90%. And finally, helmet wearing. Helmet wearing, again in South Africa, very good, but not the case in the rest of Africa. And the motorcycle epidemic is coming. I'm telling you, it is coming from North Africa. It has crept down as far as Kenya. Those of us that work in Northern Africa know that this is the motorization of the future, and we need to be ready to address it. And finally, ladies and gentlemen, we need to afford every African with access to care. And here it is really a scary thought. If you look at this slide, that nearly 60% of countries in Africa have no formal pre-hospital care system. And we really need to look at improving our health system, because we know that if we improve all these systems that I've talked about and address all these issues, that we can drive down the number of road traffic deaths.
This conference follows the global launch on the 11th of May this year of the United Nations Decade of Action for Safety on Our Roads. And the broad objective is to stabilize and then to significantly reduce over this coming decade this carnage that is happening on the world's roads. It's a multi-dimensional and multidisciplinary issue. So in the first instance, it's a health matter. You've seen the figures, 1.3 million people at least, it's possibly more, are dying on the world's roads every single year. And unless we do something drastically in this decade with determination and effectiveness, that figure is going to approach 2 million a year. Some 50 million, and it's probably more, are injured, many suffering serious disabilities. And this level of death and injury on the world's roads is, of course, a huge challenge to healthcare systems, not least in a country like South Africa. Our healthcare systems are hugely overburdened with other challenges here in South Africa. The HIV/AIDS pandemic is a huge burden. But on top of that, then, is this other massive, massive burden of serious injuries, fatalities, and so forth on our roads. So it's a health issue. And next year, when we repeat this conference, we must make sure that the Minister of Health or his representative is here. I think that's important as well, so that we're working together on these matters and not seeing it as a sort of traffic issue in some narrow way. It's a developmental issue. You know, again, as the figures from the UN and WHO told us, that 90% of the casualties are happening basically in developing countries. In South Africa, those who are at most risk of getting killed or seriously injured on our roads are overwhelmingly black and poor. And that's not just because the majority in our country happen to be black and a large number of them happen to be poor, but also simply because of the vulnerabilities that poor people have in the way in which transport systems are organized in South Africa.